Snoring is a common nighttime occurrence that affects millions of people worldwide. It's a sound that most of us are familiar with, whether we've heard it from a partner, family member, or even ourselves. At its core, snoring is the sound produced when air flows past relaxed tissues in your throat, causing them to vibrate as you breathe. This vibration creates the characteristic rattling, rumbling, or snorting sound that we associate with snoring. These vibrations are usually more intense during inhalation, but can also occur during exhalation. The loudness of snoring depends on how much air is passing through the airway and how forcefully the tissues vibrate. So it can range from a soft hum to a loud, disruptive noise that can interfere with the sleep of both the snorer and their bed partner. The prevalence of snoring is surprisingly high. It's estimated that about 45% of adults snore occasionally, while 25% are considered habitual snorers. Men are more likely to snore than women, and the likelihood of snoring increases with age. This is partly due to the loss of muscle tone that occurs as we get older, which can affect the structures in our throats. Causes of snoring. The causes of snoring are numerous and can vary from person to person. One of the most common causes is the relaxation of muscles in the throat and tongue. When we sleep, these muscles naturally relax, but in some people, they relax so much that they partially block the airway. As air tries to flow past these relaxed tissues, they vibrate, creating the snoring sound. While snoring itself isn't typically considered a medical condition, habitual snoring is usually a symptom of a more serious sleep disorder called sleep apnea. In sleep apnea, breathing is repeatedly interrupted during sleep, sometimes hundreds of times a night. This can lead to serious health consequences if left untreated. Anatomy also plays a significant role in snoring as well. People with a low, thick, soft palate are more likely to snore because this tissue can narrow the airway. Similarly, if you have enlarged tonsils or adenoids, these can restrict airflow and lead to snoring. The shape of your nose can also contribute. A deviated septum or chronic nasal congestion can force you to breathe through your mouth, increasing the likelihood of snoring. Weight is another crucial factor in snoring. Being overweight or obese increases the amount of tissue in the neck, which can put pressure on the airway and contribute to snoring. This is why weight loss is often recommended as a treatment for snoring. Alcohol consumption, especially close to bedtime, can also increase snoring. This is because alcohol relaxes the muscles in your throat, making them more likely to vibrate as you breathe. The same is true for certain medications, particularly sedatives or muscle relaxants. Sleep position can also influence snoring. Sleeping on your back allows gravity to pull the relaxed tissues in your throat downward, narrowing the airway. This is why many people find that they snore more when sleeping on their back compared to their side. Symptoms of snoring. The symptoms of snoring are primarily auditory. The sound itself is the main symptom. However, snoring can lead to a range of secondary symptoms that affect both the snorer and their sleep partner. For the snorer, these might include a dry mouth or sore throat upon waking, morning headaches, daytime sleepiness, and difficulty concentrating. In severe cases, snoring can lead to fragmented sleep, which can result in fatigue, irritability, and even mood changes. Differentiating between sleep apnea and normal snoring can be challenging, but there are key signs to watch for. While normal snoring is continuous and doesn't typically disrupt sleep, sleep apnea is characterized by pauses in breathing, followed by gasping or choking sounds. People with sleep apnea may also snore more loudly and frequently than normal snorers. This is a serious condition that requires medical attention, as it can lead to cardiovascular problems, high blood pressure, and increased risk of stroke. Therefore, it is important to distinguish between benign snoring and snoring that may indicate a more serious underlying health issue. It's important to note that while many people who snore aren't aware of it themselves, they may notice some of these secondary symptoms without realizing the connection to snoring. This is why feedback from a sleep partner can be crucial in identifying a snoring problem. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of snoring. Diagnosing snoring typically begins with a thorough medical history and physical examination. Your doctor will ask about your sleep habits, any daytime symptoms you're experiencing, and may also want to hear from your sleep partner about the characteristics of your snoring. During the physical exam, your doctor will look at the structures in your mouth, nose, and throat. They may check for nasal obstructions, enlarged tonsils, or a long, soft palate. In some cases, they might use a small camera to examine your upper airway more closely. If sleep apnea is suspected, your doctor may recommend a sleep study. This can be done either in a sleep lab or at home with portable monitoring devices. During a sleep study, various bodily functions are monitored while you sleep, including brain activity, eye movements, heart rate, blood pressure, oxygen levels, and breathing patterns. This comprehensive assessment can help determine whether the snoring is related to sleep apnea or other sleep disorders. In milder cases, a home sleep apnea test might be recommended, which allows the patient to sleep at home while wearing portable monitoring equipment. Treatment for snoring. Treatment for snoring depends on its underlying cause and severity. For mild cases, lifestyle changes are often the first line of treatment. Losing weight, avoiding alcohol before bedtime, and sleeping on one side instead of the back can reduce or eliminate snoring for many people. Elevating the head of the bed or using special pillows designed to keep the airway open can also be effective. For those whose snoring is caused by nasal issues, treating the nasal congestion or blockage can help. This might involve using nasal decongestants, antihistamines for allergies, or nasal strips that open the nostrils wider during sleep. In some cases, surgical intervention may be necessary to correct structural abnormalities in the nose or throat that contribute to snoring. For example, a procedure called uvulopalatopharyngoplasty removes excess tissue from the throat to widen the airway, while a septoplasty corrects a deviated septum in the nose. For more severe cases, or when sleep apnea is present, continuous positive airway pressure, or CPAP therapy, is usually recommended. CPAP involves wearing a mask over the nose or mouth during sleep, which delivers a continuous stream of air to keep the airway open. This prevents the airway from collapsing, eliminating both snoring and apnea events. While CPAP is highly effective, some people find it uncomfortable or difficult to use. In such cases, other options like oral appliances or surgery may be considered. Oral appliances, also known as mandibular advancement devices, are custom-made devices that are worn in the mouth during sleep. They work by repositioning the lower jaw and tongue to keep the airway open. These devices are often recommended for people with mild to moderate sleep apnea or for those who cannot tolerate CPAP therapy. While they are less invasive than surgery, they require regular follow-up with a dentist or sleep specialist to ensure they are working effectively and to prevent potential side effects like jaw pain or dental problems. It's worth noting that there are numerous anti-snoring products on the market, from special pillows to throat sprays. While some people find relief with these products, their effectiveness can vary widely, and it's always best to consult with a healthcare professional before trying any new treatment. Now, we want to hear from you. Have you or someone you know struggled with snoring? What remedies or treatments have worked for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.